It's a story straight out of a Bond movie. On September 7th, 1978, Bulgarian journalist Georgy Markov, communist defector working with the BBC, while walking on the Waterloo Bridge in London, he felt a slight sting on his right thigh. He looked behind him. All he saw is a man picking up an umbrella off the ground. By that evening, he had developed a fever. 4 days later, he was dead. The cause of death, poisoning. Markov was assassinated using an umbrella to fire a pellet lace filled with one of the most powerful toxins in the world. It's called the ricin. Ricin is one of the most deadliest poisons that is not found in animals, but it's found in plants. It's found mainly in the beans of the castor plant. Only 500 micrograms of this toxin is more than enough to kill a grown man. Ricin is extracted from the beans of the castor plant. It is extracted from the mesh left over after the beans are crushed. And actually, anybody could grow this plant in his backyard. And that's how dangerous the plant is. Also, eating 8 castor beans is more than enough to kill anybody. But what is it about the ricin's chemical makeup that makes it so effective? Well, the structure of the ricin is very complicated, but the main action is done by the chain A and B. The structure here has been solved by the X-ray crystallography. This model shows clearly the chain A and B. Chain A is the upper right as the braided ribbon, and chain B is the solid ribbon. First, the toxin binds to the cell surface receptors by its B chain and enters by endocytosis, then it forms a vesicle containing the ricin. 95% of the ricin will be eliminated by the endosome. The rest will fuse with the lysosomes and then to the Golgi apparatus, subsequently to the endoplasmic reticulum, and by the retrograde transport mechanism, cleavage of ricin chain A and B happens. And when the chain A is released into the cytosol, it exerts its action on the ribosomes to seize protein. Its effect on the ribosome is very unique and powerful, as one molecule alone can deactivate 1500 ribosomes per minute. What happens is chain A depyrinate the 28S RNA in the 60S ribosomal unit, exactly on the adenine A4324 site, by its N-glycosidase activity, leaving the ribosome inactive. It stops protein manufacture, and when protein train stops, life stops. But how toxic the ricin is when compared to other poisons? Well, scientists use the LD50 method to give a toxicity a number. LD50 stands for the lethal dose 50. Is the amount of a material given all at once, which causes the death of 50% of group test animals. The LD50 is one way to measure acute toxicity of a material. Toxicologists can use many kinds of animals, but most often used testing is done with rats and mice. LD50 is expressed as the amount of a chemical administered per 100 kilograms of body weight for the animal, and the ricin scored 1 microgram per kilogram. Signs and symptoms of ricin poisoning. The major symptoms of ricin poisoning depend on the route of exposure and the dose received. For example, if ingested, vomiting and diarrhea that may become bloody, severe dehydration may result, followed by low blood pressure. And if inhaled, within a few hours of inhaling a significant amount of ricin, difficulty in breathing will happen, along with fever, cough, nausea, and heavy sweating may follow, as well as fluid building up in the lungs. Finally, low blood pressure and respiratory failure may occur, leading to death. Death from poisoning could take 2 to 3 days. Diagnosis. Regardless of the way of exposure, ricin is extremely immunogenic, so confirmation of the ricin toxicity is through the enzyme-linked immunosorbent assay analysis of a swab sample from the nasal mucosa. The swab can be taken from the blood for more confirmation, but ricin is quickly eliminated from the blood. Now to the important part, the clinical management. There is an extremely limited information on the treatment of patients with ricin poisoning because there is a very few reported cases. Treatment of ricin poisoning is supportive and there is no known antidote. Ricin is not dialysable. Healthcare providers should continue to use standard precautions when caring for patients with suspected or known ricin associated illness. In case of ricin ingestion, Gastrointestinal decontamination should be performed, and gastric lavage may be considered if the presentation is early, generally less than 1 hour after exposure. Also, if ingested ricin was in the form of powder, liquid, or similar substances, gastric lavage with a nasogastric tube may be considered. A single dose of activated charcoal should be given if the patient is not already vomiting and the airway is secure. The current medical literature suggests that poisoning by the oral route significantly contributes to gastrointestinal losses of fluids and hypotension. Hypotension will interrupt normal perfusion of tissue and cause further organ dysfunction. Therefore, intravenous fluids for administration and blood pressure support through the use of intravenous vasopressors should be used if needed. Antidotes to ricin, sad to say, are still in the early stages of development. But because ricin takes several days to kill, compounds are being investigated that can block it from reaching ribosomes in the cells in the body. And the results were very promising and showed a great potentials. The ability of ricin to inactivate ribosomes and kill cells has been explored for therapeutic uses in cancer treatment. Clinical studies delivered promising results. However, there were a number of side effects which discontinued the clinical trials. Later, after the discovery of structure and mechanism of action, it was realized that B chain is non-specific in binding, and the non-specific binding of B chain to glycoproteins and glycolipids present on the surface of almost every kind of cells. To overcome this, many attempts has been made for several groups to create immunotoxins by coupling the B chain to an antitoxin tumor antibody.